Good evening, everyone. Welcome back to another live session. I'm Richa Caroline, one of the expert OET trainers from IILT. So today we are going to have a speaking live session, and this is actually a requested topic that we are going to discuss today, which is nothing but it's a sample of an exam question which was asked in the month of August. Okay, so the topic is nightmares. So one of the candidates, she has been asking me about how to do this particular cue card, and I thought, yes, we'll do this one, right? So in this particular session, we are going to see how this exam model cue card can be done. And in this particular cue card, as you guys can see, it's a pretty lengthy one with a lot of information that has to be said. We have to provide assurance, we have to explain certain things, and there has to be a lot of emotional level conversation with the parent too. So that is what we are going to discuss in this particular live today. So I hope everyone is doing fine. And if you guys have any questions or any doubts that you want to raise, you're free to do that too. So I'll definitely look into that while we are discussing this particular session too. Okay. Yes. So let's wait for a few minutes for others to also join, and then we'll start with the session. By that time, you guys can have a look at the cue card. This is the cue card that we are going to discuss today. I hope it is clear for you guys. All right, so let's have a look at this cue card first, and then I'll take you guys through all the conversation that we have in this particular cue card, okay? Because I have made a transcript for your better understanding so that you can see how to respond with the dialogues of the patient too, as in this case the parent. Okay, so if that is how it is being explained, then you'll have a clear idea about the entire conversation. If I'm just giving you the statements, or if I'm just telling you this is how you can do, the impact will be a little lesser compared to how we can see an entire, transcript. So I have prepared the dialogues of the parent as well, so that you guys will get a better idea about how easily you can do this one. Okay, so yes, as I told you, this is an exam cue card. This question was asked in the month of August. If I'm not wrong, the same model was asked in the month of August for the August 6th examination, if I'm not wrong. So this is the one, and we'll discuss that right now. Okay, so you can see the setting as a clinic, and do not jump into the conclusion that it's a known case or an unknown case just by reading the setting. I always say this, it's because whenever I take classes, I see this mistake often, because students just blindly come to the conclusion that this is a known case or an unknown case just by reading the setting. Do not do that. You have to read at least the background information and have a look at the task number 1, 2, so that so that you will get an idea about whether this is a known case or an unknown case. Okay, so in this particular case, let's go through the background information. You can read it along with me. So you are talking to the parent of a 6-year-old boy who is having nightmares. The parent is worried and would like to have some advice about how to deal with the situation. The child is not present, and the task number 1 says, begin with warm greetings and ask for the reason for the visit. So is it a known case or an unknown case? What do you think? So by reading this, you'll get an idea about whether we have met this particular parent before, or whether we had a previous conversation with this particular patient or the parent. So what do you think? Is it a known case or an unknown case? Well, yeah, so this is an unknown case, okay, because nowhere it is mentioned that we have a previous conversation with this particular person, okay, and we do not have any report or any hospital records of this particular patient too. So this has to be treated like a complete unknown case. All right, that is how you realize whether you're dealing with a known scenario or an unknown scenario. Okay, so now I'll take you through the transcript, okay, and we'll discuss it one by one. So you can see the task 1 here. I hope it is visible for you guys. So task number 1 says, begin with warm greetings and ask for the reason for the visit. So this is how you can start. Good morning, my name is Richa. I'm one of the registered nurses working in this clinic, because the setting was a clinic, right? And then you can say, you look worried, is everything all right? Or you can say, how can I help you? Or, may I know the reason for your visit? There are n number of ways to do that. You do not have to stick on to one particular way of doing it. As I always say, we do not have a script for it. You can come out with your own creativity, okay? You are flexible to do that. So if you are convenient and if you feel comfortable using different sentences, feel free to do that. Good, okay? So here I have chosen this way of having an opening statement. You look worried, is everything all right? So the parent is saying like this, no nurse, I'm worried about my child. He's 6 years old and recently he started to have nightmares and is not getting enough sleep. See, the parent told you the concern. So this is how we are going to provide an assurance initially, okay? Because when someone tell you the concern or some issues that they're facing or some problems that they're going through, you should not jump on to the next point. Yes, I understand that you will be in a hurry to do the tasks and try to complete the conversation, but make sure that the sequential logical flow of the conversation is maintained there. Although it is not mentioned in the cue card to console the parent when the concern is said, you have to understand you should do that. So this portion is very important when it comes to your entire structure of the role play. So let's say how we can assure the patient in this situation. This is one way of doing it, okay? So I have used a statement saying, I can understand how worried you are. Please set your mind at ease. Let me see what I can do to help you. See, that is the assurance statement that I'm using here. Okay, so we'll go through that one more time. I can understand how worried you are, because yes, we can say that she is really worried and she told us that she is worried too. Okay, so we can say, I understand how worried you are. Please set your mind at ease. Let me see what I can do to help you. You're offering help. And then you're moving on with the conversation, because we need some personal details, right? Now, if you have seen this, I have mentioned, you told me he is 6 years old, right? So this is a part of active listening. Okay? Reason being, when the parent told us the concern, the parent already mentioned he is 6 years. Okay, so you do not have to ask the same thing again, like, can you tell me his name and age? Because the age was already told to you, so you can just ask or reconfirm this by saying, you told me he's 6 years old, right? So the parent is saying, yes. Now we need a name. Can you tell me his name, please? So the parent is saying, he's Joy. So you are asking, and you are? Okay, so the parent is saying, I'm Melissa. So you might have seen the normal way of asking this particular personal details like this. I'll show you an example for that. The common way of doing it is, for my documentation, can you please help me with your son's name and age? So the parent will say, yeah, he is 6 years old, his name is Joy. And could you also tell me what is your name or what you would like to be called? So the parent is saying, you can call me Melissa. This is the common way of how the students usually do. There is nothing wrong in it, you can do it, but this is also a lighter version of it, and which is more friendly too. Okay, you do not have to construct longer sentences. Our only idea is to have a good conversation with the person that we are having or we are talking to, right? So this is a very lighter version of that too. So because here I've asked a question like, and you are? Okay, so make sure that you have a rising intonation here. Okay, like your sound goes a little higher. And you are? So she will say, yeah, I'm Melissa. So that is simple. You do not have to ask a long question here. Okay, so that is how you can collect all the personal details. So this is the task number 1, and this portion is where you collect the personal details. I hope it is clear for you guys. So let's move on to task number 2. So this is task number 2, which is pretty lengthy because we have a lot of details that we need to gather here. So let's see it. So we have to collect more details about child's nightmares. Example, onset, frequency, how the child reacts, parents' management. So we have to ask quite a lot of questions, okay? So let's see how we can do that. So the first thing the nurse is going to do is, the nurse has to signpost. Signposting is very important because there is a change in topic, because earlier what we were doing, we were gathering the personal information, right? From the parent, we were asking their name and details. So after that, what you have to do is you're going to ask some questions. So there is a shift in the topic. So what you have to do is you have to indicate that change to the parent. So here we are going to say, Melissa, I would require some information about Joy's situation if you don't mind. See? So that we are letting Melissa know that we need some information. So she will be ready with information. Okay. So here also, the normal way we have seen students using is, before proceeding further, I would like to ask you some questions. Nothing wrong in that. Okay. I'm not saying that is wrong. You can use that. But this is also another way of doing it. See, Melissa, I would require some information about Joy's situation if you don't mind. Alright, so that's a very simple statement that you can use too. So the parent is saying, I don't mind. Ask me what you want to know. Okay, so that is one. I don't mind. Ask me what you want to know. So nurse is saying, you mentioned earlier that he started having nightmares recently. Can you be more precise? Okay, that means the question was to ask about the onset. Right, you can see it here. So initially, while we were talking to Melissa, Melissa told us that she is really worried because her child, that is Joy started to have nightmares recently. So that recently was mentioned to us. So we are going to ask like when exactly it started. You can ask that question too, but this is a different way of asking that too. You mentioned earlier he started having nightmares recently. Can you be more precise? Okay, so we are actually referring to the start, the time when it started. So the parent is saying for about a month now. So we got a precise answer. Let's see the next one. The next question is frequency. So let's see how we can ask that question here. So this point is a response to the answer that the parent said here. When we asked a question like, can you be more precise? The parent said for about a month now. So we are responding to that too. Oh, I see. Okay, so make sure that you give small responses when you get answers, okay? That will enhance the entire conversation. So I see, and then you're going to ask about the frequency. How often does he have nightmares? Okay, so normally students ask a question like, how frequently does he have nightmares? So this is another simpler way of asking it. How often does he have nightmares? So the parent is going to say like this. If I recall correctly, he had nightmares almost every night. Initially, I didn't take it very seriously, but now I'm really worried as it is getting worse. You need to listen carefully here, okay? The parent just didn't give you an answer to the question. The parent also expressed his or her concern, okay? So here, it is very clearly stated that the parent is feeling guilty, like she didn't pay attention initially, she didn't take it very seriously, but now it is getting worse, okay? So you should make sure that you acknowledge that concern or the point or the feelings that were shared by the patient there before you move on to the next point. That is very important. And normally students don't do that. They will jump on to the next task, okay? And you will lose the score. So make sure that you do this in your role play. Okay, always listen very carefully, because when you do that, you are actually showing you're listening carefully to the patient or the parent here in this case, and also you're providing emotional support so that you will develop the relationship between the parent here. Okay, so that is how we can do. So let's see a good statement that you can use in this case. Okay, let me just scroll it a little bit for you. Okay, yes. The parent is saying like this. Okay. Yeah. The nurse's portion. Okay. I can sense how overwhelming it is for you. Please don't worry. We are here to help you. And then we are going to ask the next question, because we do have one more question to ask. But before that, what we have done is we have provided an acknowledgement to the concern we got, okay, because this is a concern the parent said, and before jumping on to the next question, the nurse has to acknowledge that concern. So the nurse is saying, I can sense how overwhelming it is for you. Please don't worry, we are here to help you. And then the next question. So that is the phrase that I've used. Moving on. Moving on, can you tell me how Joy reacts when he has a nightmare? Okay, so that's the next question, because we had a portion in our task to ask how the child reacts. Okay, so here I've used a sentence like that. So the parent says, he wakes tearful and upset. He is really terrified to go back to sleep. Therefore, in most days I sleep with him. Okay, so here, if we have noticed carefully, we asked a question like how Joy reacts. This is the answer for that. He wakes tearful and upset, and he is terrified to go back to sleep. The next question in our task was to ask about the management by the parent. The parent already told you that information even without us asking. Okay, so you have to listen carefully to that because you already got the information. You do not have to repeatedly ask the same question again and make the parent repeat the answers for you. Okay, so listen carefully when the parent is talking or when the patient is talking. Okay, so this is how the parent said. So now we are going to give a summary, and this summary portion is very important. When you gather information from the patient or the parent in this case, you have to provide a summary to check whether you have got all the relevant information. Also to make sure the patient or the parent has not missed out any particular details too. Okay, so that is very important. The reason why I'm saying patient is I'm not just referring to this particular cue card, I'm giving an explanation about the general cue card or general cases, okay? So whenever you're talking to the examiner or whenever you're talking to the patient or the bystander, whoever it is, make sure that after gathering all the information, you check with the patient or the parent that you have got all the relevant details and you have not missed out on anything, okay? That is very significant. So this is how you have to do all this portion, and let's look at the summary. Thank you very much for giving all the information. From what you have told me, I understand that Joey has been having nightmares for about a month now. He wakes up really petrified, and as a comfort, you sleep with him. Am I right? See the sentence? Let's read that again. Thank you very much for giving all the information. From what you have told me, I understand that Joey has been having nightmares for about a month now. He wakes up really petrified, and as a comfort, you sleep with him. Am I right? See that? Let's break it down, okay? The first line, thank you very much for giving all the information. Thank you for answering all my questions. We have heard that. This is another way of saying it. Most of you might know this statement too, okay? So you can try to use it. The next one, from what you have told me, based on our conversation, okay? Or based on what we have discussed. You can say this too. From what you have told me, I understand that Joey has been having nightmares for about a month now, because we asked a question and the parent said for about a month now. So we are going to reconfirm the same details. So he has been having nightmares for about a month now. He wakes up really petrified, and as a comfort, you sleep with him. See, it is mentioned he wakes tearful and upset. And it is understandable that when a child wakes up from the sleep after seeing a bad dream, obviously the child will be really, tensed, scared or panicked, and petrified is a really good term that you can use to indicate that thing, okay, like the child is really worried. Okay, and as a comfort, because the parent said that he's really terrified to go back to sleep, therefore in most days I sleep with him, and obviously it's understandable that it is to comfort the child. She can say, and as a comfort you sleep with him. Am I right? So this is how you can construct the statements by picking up the keywords and the statements that you received from the previous conversations. Okay, so the parent is saying that's right. That means, no, I don't have any further information to tell you. You got all the information correctly. So that is how you can do this particular portion. I hope it is clear for you guys. Let's look into task number 3. So task number 3 goes like this, okay? Provide reassurance to the parent about childhood nightmares Example, it's common, usually self-limiting by age 7. Explain the causes of nightmares, new situations or experiences, overtired, stressed, traumatic events, active imagination. Then we have to explore the relevance of these to the child. Okay, so I need to explain two main things here, and then we will look into the main portion of the explanation. Okay, so whenever you get pretty lengthy task like this where you have to give a lot of information, you need to make sure that you plan it. Plan where to stop and interact with the patient or the parent. It is important because when it comes to the assessment or when it comes to the marking, they will see whether you had, the pauses and whether you have explained everything very clearly with proper interaction. They are not going to check whether you have said everything without stopping or in a single breath. That is not what they're going to look at. They're going to look at whether you were able to communicate properly and whether you were able to express all the points and convey all the message to whoever is listening to you in a very proper manner. And the other person who is sitting next to you or across you was able to understand what you were saying without straining much. So this is what you have to fulfill too. So whenever you get a longer task where you have to explain more than one or two information, make sure that you decide on where to stop, interact, and then also decide on how to move from that pose to the next part. Okay, so that is the first thing. Second thing is this particular term. Explore the relevance of this. Most of the students get confused, and I'm telling you this, in 80% of the cases when you go for the examination, you can see this term, explore. Explore simply means find out or check. Okay, and check the relevance of these to the child, which means they are actually implying to these points which is mentioned here, new situations or experiences, because we are explaining certain causes, and then we have to check whether the mother could relate to any of these causes to the child. Okay, so we have to check whether there is any relationship, whether the mother can find out, or whether the mother can find out or think whether the mother can see whether the child is having any sort of resemblance to these portions. Okay, so that is the point that we are trying to find out. That is the meaning of explore, because we are trying to see whether there is any relation between the points that you have explained and the issues that the child is experiencing right now too. So most of the students get confused with this point. Whenever they say explore, they get confused. Okay, what I have to do right now? It simply means you have to find out or you have to check. Okay, do not get confused about that. So now let's see how we can do this particular task. As a parent, I can understand how worried you are. Yes, you have to always start with an acknowledgement statement or an empathy statement, which will always help you to get a better score. So try to do that. Okay, but I assure you that there is nothing to be alarmed about. Childhood nightmares are not unusual. See, childhood nightmares, common. Unusual, not unusual, is a good term that you can use to refer or imply common. Okay, that is what I have used here. Now, childhood nightmares are not unusual. Nightmares are bad dreams that can cause children to wake up feeling scared and upset. So this is an extra point that I've added. If you know extra points or if you are comfortable to give extra explanations, do it. Okay, so this is an extra point that I've added. Usually it gets better as they grow. Okay, so here we can see usually self-limiting by age 7. Okay, the child's age in this particular case is 6. So you can either say, it gets better as they grow. Usually by the age of 7, it might be resolved. So you can, if you want, you can add that pointer, but in this particular case I have not added it because the bracketed information are optional. It is not mandatory that you have to say each and every single word which is mentioned there. Okay, but if you want, you can do that too. Then we are checking, are you following me? Because I have decided to break it down and interact. So that is the first portion where I've decided to break and interact with the patient or with the parent here. So I asked a question, are you following me? So parent is saying, yes, I am, but what causes this? Okay, I'm following what you're saying, that it is common, but what exactly causes it? So that is what we are going to explain here. Okay, so the nurse can explain like this, something like this, okay? Well, there is a multitude of causes for nightmares, which can range from struggling to adapt to new situations or experiences, or if the child is overtired, stressed, or even from a traumatizing incident. Active imagination in children can also cause nightmares. Can you relate any of these with your child? See, that is how we can explain it. Let's go through the statement clearly, okay? So, well, there is multitude of causes. You might have heard others saying, or you might know you yourself saying, there are a lot of causes, or there are various reasons. Multitude also means that. Okay, that is another term for it. Well, there is multitude of causes. You do not have to use are there, because multitude itself shows a collective plural noun, so you don't have to use are. So you can simply say there is multitude of causes for nightmares, which can range from, because we are going to explain a lot of things, so it can range from as a good usage, you can say, okay? So it can range from struggling to adapt to new situations or experiences, which is mentioned in the task, or if the child is overtired, stressed, or even from a traumatizing incident, which is also mentioned in the task. Active imagination in children can also cause nightmares. Okay, that is extra point, which is it, active imagination is also given there. So I have created it like another sentence. Can you relate any of these with your child? Okay, because if you remember, in the task we have seen a question like explore the relevance of these to the child. So this is a question you can ask. Can you relate any of these with your child? So the parent is saying, I don't think so. No new changes have happened in his life, and I don't think he is stressed or he has any trauma. I take really good care of my child. The mother got offended because when we told the child might have any traumatizing incident, yes, that's a very sensitive thing to say, and the parent, as a parent, it might be kind of like not a very happy thing to hear. So yes, they will react or they might feel bad. So in this case, the mother felt offended, and you need to understand that too. Whenever the mother says something like this, that means the mother is trying a defensive mechanism to say that I do my part, okay, I'm a responsible mother, I do my part. So whenever you hear something like this, make sure that you comfort the mother and then move on to the next point. Okay, so let's see how we can do that. So this is how I'm trying to comfort the mother here. I'm sorry, Melissa. What I have told you are the possible reasons why children of this age have nightmares. I didn't mean to imply that he is traumatized or stressed. There is no doubt you are a great mother. I hope you understand my point. See how you can do that? Let's go through that again. I'm sorry, Melissa. What I have told you are the possible reasons why children of this age have nightmares. Again, we are not referring to Joy, that is the child in this case, alone. Because when you pinpoint like that, it is like a very direct accusation or a very direct explanation of that particular person. So we have to use a generalized explanation like this. Why children of this age have nightmares. We are not simply saying why Joy has it, okay? Or this is the reason why Joy exactly has it. We are giving a generalized explanation, which is always a better thing to do. Okay, so you can say this. What I have explained are the possible reasons why children of this age have nightmares. I didn't mean to imply that he is traumatized or stressed. Okay, my point of explanation was not to say that he is traumatized. What I said is these are the reasons. Okay, and then you can say there is no doubt you're a great mother. Okay, just try to comfort her. I hope you understand my point. Okay, that's a very beautiful and a very comforting statement that you can tell to someone who is offended or who got offended from what you have said. Okay, so the parent is saying, yes, I get it. Okay, I understand what you're saying. So the next point, we need some more information. Okay, so before we discuss that, I need to show you task number 4 too, because there is a connection between the next conversation and task number 4. So in task number 4, when you have the cue card, you can see that we are going to discuss about bedtime stories. Okay, so but so far in the conversation, we didn't come across bedtime stories. So in order to come across that particular topic and in order to talk about it, we need some start to that particular topic. So to lead the patient or the parent to that area of discussion, what I have done here is I used a statement like this. Can I please ask you something? So that we will get into the discussion of bedtime stories and we can lead the parent to the next task as well. Okay, so a simple question, can I please ask you something? So the parent is saying, sure, what is it? The question is like this, do you or anyone read bedtime stories to Joy? Okay, so the parent is saying yes, his father and I do read bedtime stories to Joy. He loves to listen. Okay, so the nurse is saying, what genre of stories do you read to him? So parent says the usual ones, the usual bedtime stories. Sometimes my husband reads fictional stories to him. Okay, remember this point. We got the detail that we need. Okay, so now let's look into task number 4. Explain likely trigger for child. Bedtime stories, active imagination. Make suggestions for prevention of nightmares. Avoid horrifying bedtime stories, TV programs at night. Adopt a calming bedtime routine, use night light. Give advice on management of nightmares. Talk about nightmares during daytime and discuss what's worrying the child. Encourage the child to stay calm. Keep the bedtime routine light and happy. Comfort and reassure the child. Too many information, right? Too much of that. So let's see how we can break it down and simplify it. Okay, don't get really tensed or don't panic just by seeing the length of the task. You can break it down into sessions and then you can explain it like that. Okay, so then you don't have to worry about it. You just have to make sure that you're covering the important relevant points. Okay, so let's see how we can do it here. So the first point is, we are going to say the child might be in a stage of active imagination, and that is the reason why he might be experiencing these nightmares. So let's see how we can put that particular message into few sentences. So we're going to start by saying, all right, Melissa, from what you have told me so far, I suspect listening to bedtime stories is triggering him. Okay, so here if you have noticed, explain likely trigger for child, bedtime stories. So that is the triggering factor we have. So that point is been explained like this. I suspect listening to bedtime stories is triggering him. Don't stop there. Okay, give an explanation for your clinical observation. You told me he's fond of bedtime stories. Okay, because earlier Melissa told us that her husband and she reads to the child and the child really loves it. Okay, so that is a point which is explained here. You told me he's fond of bedtime stories. That means he might be thinking about it subconsciously. This makes him to have an active imagination. Okay, that is the reason why he has nightmares. So this is how we are going to explain that point. Okay, so if you just go back to the task simply says this point: bedtime stories, active imagination. From that single line, this is what you have to develop. Okay, because you have to explain what is active imagination there and how that active imagination is happening, and that is the reason why the child is having nightmares. Okay, so this is how you can explain. All right, Melissa, from what you have told me so far, I suspect listening to bedtime stories is triggering him. You told me he's fond of bedtime stories. That means he might be thinking about it subconsciously. This makes him to have an active imagination. That is the reason why he has nightmares. Okay, so that is the explanation you can give here. So the parent is saying, I understand. So the nurse can say, try not to worry. As I have told you, this is very common in children. I can give you some suggestions to prevent nightmares. Going back to the task, that is our next point, make suggestions. Okay, so we're going to explain that point. To begin with, avoid horrifying bedtime stories or TV programs at night. As he has nightmares, it is highly advisable to introduce a calming bedtime routine for him. You can either tuck him and talk to him for some time or make him listen to soothing music which will help him to fall asleep. You can also use night light to make him more comfortable. It is very important that he is falling asleep without overly thinking about anything. Are you clear with what I'm saying? Okay, it might take some time for you to go through this point. So what you can do is you can refer to this point and cross check it with the task. Okay, because in the task we are explaining about avoiding horrifying bedtime stories, TV programs at night, adopt a calming bedtime routine, use night light. These three points, okay, and that is what I've explained from here till here. Okay, so you can have a closer look at it. I've told him to avoid horrifying bedtime stories or TV programs at night. As he has nightmares, it is highly advisable to introduce a calming bedtime routine for him. And I just explained what she can do. Okay, you can give some explanation from your point. You can come up with your own creativity, what you feel is right, or whatever you feel like, yes, if the mother does like this, the child will be feeling better. If you feel like that, then you can do that too. So here what I have done is, I mentioned you can go tuck the child in and be with him, talk to him for some time and make him listen to soothing music without telling any exciting or horrifying stories, because a child has active imagination. So the child will think about it before sleep, and while asleep the child might have nightmares. Okay, so this is a point you can explain. And you're saying, are you clear with what I'm saying? This point is very important. Okay, always make sure the patient is understanding what you're saying, and if you check the understanding of the patient, you will get a better score too. Okay, so the parent is saying, yes, I will follow what you have told me. So the next point, that's great. I would also like to share a few things with you. May I? Okay, because we haven't finished task number 4. If you go back to the task, you can see one more main point here. Give advice on management of nightmares. Okay, so we have to go back and see how we can give that. Try to have conversations of nightmares during daytime and try to figure out what's worrying your child. Try to figure out whether there is a pattern for his nightmare. If I recall correctly, you mentioned he has these nightmares often. So possibly there might be a pattern to it. Based on that, you can reassure your child and keep him happy. This is a time when comfort and cuddling your child is appropriate. See, this explanation is completely a creativity based explanation, okay, because I decided to just twist the entire point which is given in the tasks there, because I really didn't want it to go line by line or point by point. It might make the entire conversation look a little scripted. So what I did was I understood the point from that. I picked the main keywords and then developed an explanation which will convey the meaning but in a very different approach. Okay, so that is how I have explained it here. So here you can see a lot of points which is not given in the cue card, because in the cue card is just mentioned the mother to have daytime conversations about the nightmares, about the pattern and things like that, which is something which came out from the creativity or from the knowledge that you have about nightmares. It can happen too, you can do that too. Okay, so try to have different explanations, but make sure that the major points of the cue card is also explained. If you have a closer look here, the points about keeping the child happy or comfortable, all the points are mentioned there, the keywords are there. It's not like this is something which is totally out of the box. The keywords are there, but the explanation and the approach of the point is different. Okay, so that you can also try to do that. So the parent is saying, I'll keep this in mind. So that is how you can finish the entire task number 4, which is pretty lengthy. If you look at this, you need to explain a lot of things for task number 4. Yes, you can have a closer look at that. Okay, let's move on to task number 5, which is our last task, which is simple. Okay, warn the parent about the risks of sleeping with child after nightmare, dependent on parent association of nightmare with being alone. So the main point here that we are trying to explain is, we have to tell the parent that it is not good or it is not advisable to sleep with a child when the child wakes up from sleep, because she told us that the child wakes up tearful and upset, and to comfort him, she sleeps with him at night. So we are going to tell her a few things that it's not good, it's not healthy, because the child will become more dependent. Okay, so let's see how we can explain that. Please encourage your child to go back to sleep alone. Avoid sleeping with your child every time he wakes up. This can cause over-dependency, and the child will start to think nightmares occur when he is alone. Therefore, avoid sleeping with the child after nightmare. Okay, so parent says, of course. So the nurse is asking, do you have any other concerns? Parent says nothing else. So nurse says, feel free to contact us if you need any help. Take care. Okay, because you won't have enough time to give a very detailed conclusion here because you have a lot of points to talk here. Okay, so this is a very simple but effective way of concluding the entire thing. Okay, so this is how you can approach this entire cue card. Okay, so I hope it is clear for you guys. So this was one of the exam cue cards which was recently asked. So I hope you guys have a clear idea about how you can explain it, and this is for those who have not written the exam and for those who don't have an idea about how the exam cue cards will be, this is a sample for you guys. This is a similar sample about how the exam question papers will be, how the terminologies will be, because normally we don't see such terms like explore or likely trigger or unlikely. These terms might not be there in the usual cue cards that you use to practice, and when you go for the examination you come across certain terms like this and you get panicked about what is that, what is the exact meaning of it. Don't worry, if you don't understand any word or anything in the cue card, you're free to ask the interlocutor during the 3 minutes preparation time what this means. Okay, if you don't have an idea, do that. Don't go with wrong assumptions. Okay, so this is a model for it, and I hope it is clear for you guys. So I'll come back with another live very soon with another topic like this. So if you have any suggestions about any other topic that has to be discussed or any other points like that, feel free to comment in the comment section, because you can find this live as a recorded point or recorded video later in our YouTube channel or our FB channel too. So make sure that you guys watch it, and you can give your suggestions too. If you want any particular topic to be discussed, be it reading, listening, writing or speaking, drop it and we will definitely look into it. Okay, so I hope it was clear for you guys. I'll see you guys next time. Until then, take care. Bye bye.